Greetings, class, and welcome to Module 5. So we're halfway past the midpoint, and this term is moving along very quickly. Again, this term is only 8 weeks, so 3 weeks remaining. Not a lot of time, so let's finish strong. And I want to take a look at the chapters, and while these chapters are so relevant to the circumstances that we have experienced over the past 3 years, right? It's interesting to think that the next time that this textbook publishes, that the COVID-19 pandemic will be listed as one of the notable epidemics within your textbook. So we know there have been a number of medical, legal, and ethical challenges that were brought forward by the COVID pandemic, right? You've read the reports, and you may have sat with your colleagues at your organization and talked about how you were going to meet those challenges when they were on the forefront. One of the challenges that presented itself first was the limited number of tests. So let's think back to that time. Decisions had to be made early on which members of the population should have access to the tests first. And it was not always clear where the line should be drawn. And so those policies and recommendations evolved over time as we learned more, and then, of course, as more tests became available. One of the next issues that surfaced was how positive cases should be reported in order to also protect the privacy of individuals. So we need to consider, did maintaining the privacy of the individual do more harm to society? Also, many healthcare organizations were not prepared to meet the needs of healthcare professionals at the bedside during the pandemic. I know that some of you have experienced this. So, what were the professional responsibilities of the healthcare worker in treating patients with this virus when healthcare supplies were not readily available that were important in the provision of care? The professional responsibilities of treating someone who had the COVID 19 virus when we have adequate personal protective equipment is pretty simple, right? We know that healthcare professionals have a professional obligation to provide care. But what happens when that personal protective equipment is not available? What were the professional obligations? Is it ethical to ask a new mom or an elderly nurse who may be providing care to an immunocompromised family member to provide care to a patient with the COVID 19 virus when adequate PPE was not available? Um, was it ethical to so I want you to think about those questions and think about and reflect back on that period of time. There were many more ethical and legal issues with the COVID 19 pandemic. There were many questions raised with regard to the allocation of scarce resources, such as ICU beds, ventilators, and certain medications. Think back to that time. Your book discussed in times of catastrophe that there is more of a utilitarian approach. Some of you may be familiar with the National Strategic Stockpile. And from the beginning, during the COVID 19 pandemic, there was a national issue with the strategic stockpile, and the needs of the country could not be met. And so that was a problem. Supply issues existed as well as distribution issues. A lot of our PPE was being manufactured in China. So healthcare professionals were also being asked in the event that PPE was available that single use masks be used multiple times, right? So COVID 19 presented challenges not only to the healthcare professional, but also to patients and families as well. Because we know that family centered care was impacted tremendously during the COVID 19 pandemic. And I'm sure some of us may be able to share personal stories on that. We had residents in long-term care facilities, patients who were in hospitals, who were not able to receive visitors because of the COVID-19, because of the COVID-19 pandemic. And there were a lot of ethical and legal issues raised with regards to whether or not a hospital had the right to deny you the right to watch your spouse's baby being delivered or be there um, the last few days of a loved one's life. So these are important questions to reflect back on, important ethical questions to consider as we move forward. I want you to take some time to review the questions that I have posted online. In addition to the questions that I've posted online, you might explain what are the next steps in increasing preparedness for disasters. So you might think about answering that question. It's important that you recognize, and your book talks about this, it's important that you recognize how past public health epidemics have helped inform us today, and how past public health epidemics have contributed to public health changes. But I want you to think about, and you can answer this in discussion if you'd like as well. Think about what are your ethical obligations with respect to this um, in the future. How do we take what we have learned during the COVID-19 pandemic to better prepare us for the future? It's important to ask ourselves why our organizations were not prepared so that we can meet the needs of the population should an event similar occur in the future. I am looking forward to a very interesting and engaging conversation this week. Please do not hesitate to reach out to me if you have any questions or concerns. Thank you so much.